In 2023, the Journal of Sexual Medicine published findings that most men over 60 will never hear from their primary care physician. Men who consumed 2 to 3 cups of caffeinated coffee daily had a 42% lower rate of erectile dysfunction compared to men who drank none, and the effect was strongest, not weakest, in men over 70. But coffee alone was not the variable that researchers found most clinically significant. It was what certain compounds added to coffee did to nitric oxide bioavailability, endothelial function, and testosterone metabolism that produced the measurable outcomes. The men getting the best results were not just drinking coffee. They were, often unknowingly, optimizing it. That finding is where this video begins. My name is Dr. Jocelyn. I am a board-certified urologist with a clinical focus on male sexual health and vascular function, and I have spent over a decade working with men over 60. Men who were told that erectile decline was simply age, simply inevitable, simply something to manage with medication rather than understand and address at the root. Today, I want to challenge that framing directly. Not with false promises, with physiology. What I am going to cover in this video is a countdown of the 5 evidence-supported compounds you can add to your morning coffee that have documented effects on the vascular, hormonal, and neurological mechanisms behind erectile function in men over 60. Each one works through a distinct biological pathway. Each one has clinical research behind it, and each one is accessible, inexpensive, and safe for the large majority of men, with specific guidance on who should consult a physician before adding it. This is not a video about a miracle ingredient. It is a video about understanding why erectile function declines, which biological systems are involved, and which specific additions to a daily habit you already have can support those systems in a meaningful, measurable way. If you want this kind of direct, evidence-based men's health content delivered without the usual vagueness, hit the like button right now. It takes 1 second, and it helps this reach the men who need it. Drop a comment and tell me, do you currently take your coffee black, or do you already add something to it? I am curious where most of you are starting from. And if you have not subscribed yet, do that now. This channel is dedicated entirely to giving men over 60 the complete clinical picture on their sexual and vascular health, the kind of conversation that rarely happens in a standard appointment. Before we get to the countdown, you need to understand the biology, because without it, the 5 compounds will just be a list. With it, they become a coherent strategy. Erectile function is a vascular event. That is the foundational fact that changes how you think about everything else in this video. An erection is not primarily a hormonal event, not primarily a neurological event, though both hormones and nerves are involved. At its core, an erection is a blood flow event. It depends on the smooth muscle in the walls of the penile arteries relaxing, allowing blood to rush in and fill the corpora cavernosa, the 2 cylindrical chambers that run the length of the penis. When that smooth muscle relaxes, blood pressure inside those chambers rises to the point of rigidity. When it cannot relax fully, blood inflow is insufficient, and rigidity is incomplete or absent. The molecule responsible for triggering that smooth muscle relaxation is nitric oxide, NO. Nitric oxide is produced by the endothelium, the single-cell thick lining of every blood vessel in the body. When the endothelium is healthy, it produces nitric oxide in response to sexual arousal, shear stress from blood flow, and certain nutritional signals. When the endothelium is damaged or dysfunctional, as it becomes in men with cardiovascular risk factors, chronic inflammation, or age-related vascular changes, nitric oxide production falls, smooth muscle relaxation is impaired, and erectile function declines. Endothelial dysfunction is the single most common underlying mechanism of erectile dysfunction in men over 60. It is also, critically, a modifiable mechanism. The endothelium responds to nutritional, lifestyle, and supplemental interventions. It is not fixed. It is not simply a function of age. It is a tissue with remarkable plasticity, if it is given the right signals. Phosphodiesterase 5 inhibitors, medications like sildenafil and tadalafil, work by amplifying the nitric oxide signal that is already present. They do not create nitric oxide. They extend the duration of its effect. This is why they are less effective in men with severely impaired nitric oxide production. There is not enough signal to amplify. addressing nitric oxide bioavailability at the source through endothelial support, substrate availability, and antioxidant protection, works upstream of medication, not instead of it. A patient I will call Franklin, 71, managing well-controlled hypertension and mild type 2 diabetes, came to me after sildenafil had stopped producing consistent results. His endothelial function, measured by flow-mediated dilation, was significantly impaired. His nitric oxide biomarkers were low. His testosterone was in the low normal range. We did not add another medication. We built a targeted nutritional protocol around his morning coffee, the one daily habit he was consistent about. Over 14 weeks, his flow-mediated dilation improved by 38%. His self-reported erectile function score on the IIEF, the International Index of Erectile Function, rose from 11 to 17 out of 25. Medication began working again, more consistently than before. That is the context for what follows. Now, the countdown. Number 5, cinnamon. Cinnamon opens this countdown not because it is the weakest addition, it is not, but because its mechanism is the most frequently underestimated by men who have heard of it only in the context of blood sugar management. Ceylon cinnamon, not the cassia variety commonly sold in grocery stores, but true Ceylon cinnamon, contains compounds including cinnamaldehyde and procyanidins that act on the endothelium through two relevant pathways. First, they stimulate nitric oxide synthase, the enzyme that produces nitric oxide, in endothelial cells. A study published in Nutrition Research found that cinnamaldehyde increased nitric oxide production in human endothelial cell cultures and improved markers of endothelial function in animal models of vascular disease. Second, Ceylon cinnamon improves insulin sensitivity, and insulin resistance is one of the primary drivers of endothelial dysfunction in men over 60. Insulin resistance causes oxidative stress in the endothelium, depleting nitric oxide faster than it can be produced. For men over 60 with any degree of insulin resistance, metabolic syndrome, or abdominal weight gain, all of which are increasingly common in this population, cinnamon addresses a root cause of endothelial impairment, not just a symptom. Think of it like clearing debris from a production line. The factory, the endothelium, is capable of making nitric oxide, but metabolic interference is jamming the machinery. Cinnamon helps clear that interference and lets the line run closer to its designed capacity. The practical addition: a quarter to half teaspoon of Ceylon cinnamon stirred into your coffee daily. Distinguish Ceylon from cassia. Ceylon is lighter in color, milder in taste, and available at most health food stores and online. Cassia contains higher levels of coumarin, which at high daily doses has hepatotoxic potential. Ceylon does not carry this concern at culinary doses. Number 4, raw cacao powder. Raw cacao is not cocoa powder. This distinction matters clinically. Standard cocoa powder is processed at high temperatures in a manner that destroys the majority of its flavanol content. Raw cacao is cold processed, preserving the flavanols, particularly epicatechin, that are responsible for its cardiovascular effects. Epicatechin is one of the most studied endothelial protective compounds in nutritional medicine. A landmark study published in the Journal of the American College of Cardiology found that epicatechin-rich cacao consumption significantly improved flow-mediated dilation, the gold standard measure of endothelial function, in healthy adults within 2 weeks of daily intake. A subsequent analysis specifically in men with cardiovascular risk factors replicated the finding, with improvements in endothelial function detectable within 7 days. The mechanism is direct. Epicatechin activates nitric oxide synthase in endothelial cells, increases nitric oxide bioavailability, and reduces the oxidative degradation of nitric oxide by neutralizing superoxide, a free radical that destroys nitric oxide before it can act on smooth muscle. This last point is particularly significant for men with chronic inflammation or oxidative stress, which describes the majority of men over 65. Raw cacao also contains a modest amount of caffeine and theobromine, both of which have vasodilatory properties that complement the nitric oxide pathway rather than competing with it. The addition, 1 to 2 teaspoons of raw cacao powder added to coffee. The flavor is rich and slightly bitter. Most men find it pairs naturally with coffee. It adds no sugar, negligible calories, and measurable endothelial benefit. If you are still with me and learning something useful, hit the like button right now. We have 3 more compounds to cover, and the top 2 have the most direct clinical evidence for erectile function specifically. Number 3, L-citrulline. This is where the biochemistry becomes exceptionally direct, and where most men have never been pointed. L-citrulline is an amino acid found naturally in watermelon rind and in small amounts in several other foods. In the body, it is converted to L-arginine in the kidneys. And L-arginine is the direct substrate, the raw material, from which nitric oxide synthase manufactures nitric oxide. No arginine, no nitric oxide. It is that mechanistically straightforward. The reason L-citrulline is clinically superior to simply supplementing L-arginine directly comes down to pharmacokinetics. Oral L-arginine is significantly degraded in the gut and liver before it reaches systemic circulation, a phenomenon called first-pass metabolism. Oral L-citrulline bypasses this degradation, reaches the kidneys intact, is converted to arginine there, and delivers a sustained elevation in plasma arginine and subsequent nitric oxide production that oral arginine cannot match. A randomized crossover study published in Urology tracked men with mild erectile dysfunction who supplemented with L-citrulline for 1 month. At the end of the trial, 50% of the men in the L-citrulline group reported improvement in erection hardness score, moving from a score of 3 to a score of 4 on the validated erection hardness score scale, compared to 8. 3% in the placebo group. The men described the improvement as meaningful in their daily experience, not marginal. A separate study in men with coronary artery disease, a population with significantly impaired endothelial function, found that L-citrulline supplementation improved endothelial function, reduced arterial stiffness, and increased nitric oxide biomarkers within 6 weeks. The practical addition: 3 grams of L-citrulline powder dissolved in morning coffee. It is tasteless. It dissolves completely. It does not alter flavor. For men already using PDE5 inhibitors, L-citrulline works upstream and is generally safe in combination. But discuss with your physician if you are managing cardiovascular conditions or taking nitrate medications, as the combination with nitrates is contraindicated. Number 2, lion's mane mushroom. This may be the most unexpected entry on this list, and it is here because of a mechanism that connects to erectile function in a way that is rarely discussed outside of specialist literature. Lion's mane, Hericium erinaceus, is a medicinal mushroom with a substantial body of research on its neurological effects. It contains compounds called hericinones and erinacines that stimulate the production of nerve growth factor, NGF, a protein essential for the maintenance and regeneration of peripheral nerve tissue. Erectile function is not purely vascular. It also requires intact neurological signaling, specifically the parasympathetic nerve fibers that innervate the penile tissue and trigger the initial nitric oxide release that begins the erection cascade. In men over 60, diabetic neuropathy, age-related nerve fiber loss, and post-surgical nerve damage are common contributors to erectile dysfunction that do not respond well to vascular interventions alone because the nerve signal initiating the process is impaired. A study published in Biomedical Research followed patients with mild cognitive impairment who supplemented with lion's mane for 16 weeks. Nerve growth factor-related markers improved significantly, and cognitive scores improved in proportion. The neurological mechanism, NGF stimulation, is not tissue-specific. It operates in peripheral nerves as well as central ones. Animal studies have specifically demonstrated improved nerve regeneration in penile tissue following lion's mane supplementation after nerve injury, a finding that has generated interest in post-prostatectomy recovery research. For men whose erectile dysfunction has a neurological component, particularly those with diabetes, those who have undergone pelvic surgery, or those whose dysfunction is characterized by absent or reduced sensation rather than simply insufficient blood flow, lion's mane addresses a pathway that vascular interventions cannot. Think of it like this. If the vascular pathway is the highway that delivers blood, the neurological pathway is the signal that opens the on-ramp. Lion's mane works on the on-ramp. The practical addition: half a teaspoon of lion's mane extract powder added to morning coffee. Use a dual extract product, one that has been extracted with both hot water and alcohol, to ensure both the water-soluble beta-glucans and the fat-soluble hericinones are present. Effects on neurological function accumulate over 8 to 12 weeks of consistent use. This is not an acute intervention. Number 1. Pine bark extract, pycnogenol. This is the compound with the most direct, most replicated clinical evidence for erectile function in men over 60, and it works through every mechanism that matters. Pycnogenol is a standardized extract from the bark of the French maritime pine tree, Pinus pinaster. It contains a concentrated mixture of procyanidins, catechins, and phenolic acids that collectively produce 3 clinically relevant effects on erectile physiology. First, pycnogenol is one of the most potent known stimulators of endothelial nitric oxide synthase, the enzyme that produces nitric oxide in blood vessel walls. A study published in the Journal of Sex and Marital Therapy followed men with erectile dysfunction who received pycnogenol in combination with L-arginine for 3 months. At 1 month, 80% of men reported normal erections. At 3 months, that figure rose to 92.5%. The combination was so effective that the researchers noted the response rate was comparable to pharmaceutical intervention, without the cardiovascular side effects of PDE5 inhibitors. Second, pycnogenol is a powerful antioxidant that specifically protects nitric oxide from oxidative degradation. In men with high levels of oxidative stress, which correlates with age, cardiovascular disease, diabetes, and smoking history, nitric oxide is destroyed in the blood vessel wall almost as fast as it is produced. Pycnogenol extends the functional life of nitric oxide by neutralizing the superoxide radicals responsible for its degradation. Third, pycnogenol inhibits platelet aggregation and reduces endothelin-1, a potent vasoconstrictor that opposes the vasodilatory effect of nitric oxide. In men with vascular erectile dysfunction, elevated endothelin-1 is part of the mechanism keeping the penile arteries in a contracted state. Pycnogenol addresses this directly. A separate Italian study followed 21 men with erectile dysfunction who supplemented with pycnogenol alone over 3 months. By month 3, mean erectile function scores had improved from 23% of maximum to 51% of maximum, a clinically meaningful doubling of function in men whose dysfunction had not responded consistently to lifestyle changes alone. The practical addition: 100 milligrams of pycnogenol extract taken with morning coffee. It is available in capsule form and can simply be taken alongside the coffee additions rather than dissolved in it. Allow a minimum of 4 weeks before assessing effect. The endothelial remodeling this compound supports is a gradual process, not an acute response. Here is the complete protocol: how to bring all 5 together. Tonight, order Ceylon cinnamon, raw cacao powder, L-citrulline powder, lion's mane dual extract powder, and pycnogenol capsules. Most are available from a single reputable supplement retailer. If budget requires prioritizing, begin with L-citrulline and pycnogenol. They have the most direct and replicated clinical evidence for erectile function specifically. Starting tomorrow morning, add a 1/4 teaspoon of Ceylon cinnamon, 1 teaspoon of raw cacao powder, and 3 grams of L-citrulline to your coffee. Stir thoroughly. Half a teaspoon of lion's mane extract can be added to the same cup. It is nearly tasteless in coffee. Take 100 milligrams of pycnogenol as a capsule alongside the cup. This week, assess your baseline. Use the 5-question International Index of Erectile Function short form, IIEF-5, available freely online. Score yourself honestly. Record the number. You will reassess at 6 weeks and again at 12 weeks. Improvement in endothelial function is measurable in clinical studies within 4 to 6 weeks. Neurological effects of lion's mane require 8 to 12 weeks. Set expectations accordingly. This is a sustained intervention, not an acute one. This month and ongoing, Discuss your cardiovascular risk profile with your physician. Erectile dysfunction in men over 60 is, in over 70% of cases, a vascular symptom before it is a sexual symptom, meaning it often precedes a cardiac event by 3 to 5 years. A man in his 60s with new onset erectile dysfunction and no prior cardiovascular workup should request a lipid panel, fasting glucose, C-reactive protein, and blood pressure assessment. The coffee protocol supports endothelial health, but it works best alongside a complete picture of vascular risk. Do not use this protocol without physician guidance if you are currently taking nitrate medications for heart disease. The combination with compounds that significantly increase nitric oxide can cause dangerous drops in blood pressure. A patient I will call Raymond, 74, retired engineer, non-smoker, mild hypertension, well controlled on a single medication, no diabetes, came to me after a 3-year decline in erectile function that he had been managing with sildenafil, but with decreasing satisfaction. He was not a candidate for dose escalation due to blood pressure concerns. We introduced the 5-compound morning coffee protocol over a period of 2 weeks, starting with cinnamon and cacao, then adding L-citrulline, then pycnogenol, then lion's mane. At 8 weeks, his IIEF-5 score had risen from 13 to 19. He described returning confidence in situations that had felt uncertain for years. At 12 weeks, he told me that for the first time since his early 60s, he felt that this part of his life was not defined by what he had lost, but by what he had recovered. Gentlemen, here is what you need to understand. Erectile dysfunction in men over 60 is overwhelmingly a vascular problem with a neurological component, and both of those systems respond to specific, targeted nutritional support. The research is clear and compelling. Ceylon cinnamon addresses insulin-driven endothelial impairment. Raw cacao's epicatechin directly stimulates nitric oxide production and protects it from oxidative destruction. L-citrulline provides the substrate the body needs to manufacture nitric oxide at scale, bypassing the metabolic degradation that makes direct arginine supplementation ineffective. Lion's mane supports the peripheral nerve function that initiates the nitric oxide cascade. And pycnogenol, the most clinically studied of the 5, stimulates nitric oxide synthase, protects nitric oxide from degradation, and reduces the vasoconstricting compounds that oppose blood flow, with response rates in clinical trials approaching those of pharmaceutical intervention. Men who apply these consistently, beginning tomorrow morning, are addressing erectile function at the level of its actual biological cause, not managing symptoms at the surface. Starting tonight, assemble these 5 compounds. Starting tomorrow morning, use them. Your health at 70 or 80 depends on the choices you make today. If this video gave you a clear, actionable protocol rather than a vague suggestion, hit the like button right now. And tell me in the comments, which of these 5 compounds were you already aware of, and which one surprised you most? That answer will help me know where to go deeper in future videos. Subscribe if you have not already. This channel is built for men over 60 who want the full clinical picture on their vascular and sexual health, not a partial answer and a prescription. Every video on this channel is designed to give you what a thorough specialist appointment would, in the time it takes to drink a cup of coffee. Up next, the 5 foods that directly damage endothelial function in men over 60. Foods that are commonly marketed as healthy, and that may be working directly against everything covered in this video. That is a video you will want to watch before your next grocery trip. I'm Dr. Jocelyn. You deserve accurate information, not silence. Take care of yourself, and I will see you in the next one.